Hi, this is Alexandra Schilling, and this is my newborn assessment for OB. We're going to be using this little guy. And then I've got my thing here. So we'll check the posture, and he has flexed extremities that move freely and resist extension. We're return quickly to the flexed state. The hands are usually clenched, and his movements are symmetric. So for vital signs, we're going to do an axillary temperature, and he is within 36.5 to 37.5 Celsius. And then, his respirations are also within normal limits of 30 to 60. And then apical pulse, we'll say, is between 120 and 160 as well. We're not going to take a BP on him because his pulses are symmetrical. So he was a cesarean birth, so his head is nice and round. And then the circumference of it, we're going to measure right above the forehead, or at the eyebrows. And he is within the limits of 38 centimeters. And the chest circumference as well, right at the nipple line. And he is 30 to 36 centimeters. So we'll move that. And then we're going to check out his skin, and he doesn't have any birthmarks or a sign of a rash or any lesions or bruising or signs of infection anywhere. He does have a little bit of lanugo on his shoulders, and his ears are a little fuzzy. His skin turgor is great, so he's hydrated, he's pink, has no signs of cyanosis. For the fontanelles, his anterior fontanelle is within normal limits, and same with the posterior. There are no signs of dehydration or brain swelling. His eyes are symmetrical and a little bit swollen from childbirth, but the edema will go down. And he seems to be moving his little eyes. We're gonna look at your little nose, and there's no obstruction with his nose, with no signs of difficulty breathing. And his ears are within normal limits as well. There's no lesions or abnormalities noted there. He will get his hearing tested later on. The mouth and chin seem to be within normal limits. His tongue and gums and mouth in general just are pink and healthy, and his tongue is moving freely. He is showing signs of rooting and has a normal gag reflex. He's also swallowing appropriately. His cry is very strong. And his neck, he's got a full range of motion there as well. His chest has a cylinder shape. It's very symmetric. His nipples are present, and there's no supernumerary nipples noted as well, with no discharge. And same for the breast tissue. They're not engorged, and there's no sign of infection. And then we're going to listen to his lungs. His chest movement is symmetrical. So lung sounds are clear and present bilaterally. We'll do the heart sounds too while we're here. So with him, I'm going to listen for S1 and S2, and they are heard. I'm going to check out the aortic, pulmonic, tricuspid, and mitral, and his heart seems to sound great. No signs of a murmur. Do abdomen too while I'm here. Listen to your belly. All right, you have bowel sounds present in all 4 quadrants. He has not passed any meconium yet because he's only a couple minutes old, nor has he voided yet, so we'll keep an eye on that. But meconium will look for the dark tarry-like substance that he's going to excrete, and then urination will look for what sometimes can have the brick dust of the uric crystals, but that's pretty normal. His umbilical cord looks normal as well. There's no signs of infection. He has the 3 vessels, and it is not, like I said, no signs of infection there. So because he is a he, we're going to check out the little family jewels. And he has 2 testicles inside of a scrotal sac that has rugae, so everything seems to be here. Sometimes it can be a little swollen after childbirth due to the mother's hormones, but that will go down. While I'm here, I'm going to check out his little anus, and he seems to have all of his parts there. And no signs of abnormalities that I would need to notify the provider about. We're going to check out your upper extremities. He's got all of his fingers. Everything is moving great. Bilateral formation, everything seems to be matching both sides. He has nails, and the palm creases are normal. We're going to do the same with the lower extremities. They are the same length. He has 10 toes. They move normally. And his hip does not have any the hip clunk sound. His feet are in a good position. We're going to check out your back. He has no signs of spina bifida. His spine seems to be within normal limits. And his pulses, we'll check those. Those are equal bilaterally. His weight, we weighed him, and he is between the normal range of 5 pounds 8 ounces and 8 pounds 13 ounces, so he is healthy. We're going to check your length next. We're going to use this again. So his head will be back up to the board, perfectly matched up, and then we're going to match to a flexed foot. So he is within the range of 19 to 21 inches, which is normal for him. And now we're going to check your reflexes. So rooting, he is definitely rooting and wanting to suckle. The moral reflex, he is startled, which is good. Tonic neck, so if he's going to look this way, this arm may come up and this arm may come down. Same with looking this way. The Babinski, his toes are flared, which is a good sign, not a good sign in an adult. Palmar grasps, he has that. Plantar toes curl tightly. And then the stepping, when I put one down, he's gonna make it look like he's walking. And he is healthy and great and had a good assessment. Thank you.